Hello friends, I am Dr. Rakesh Munda, consultant urologist, Preeti Hospital, Gachibowli. This is an awareness program regarding kidney stones and diet for kidney stones. So first we should know what is kidney stone and when it comes and what are the risk factors for it and what is the treatment and what is the prevention. So first of all, kidney stones is different from gallstones. There are like two kinds of stones inside body which happens gallstones which comes inside the gallbladder and kidney stones. Gallstones treatment is different because we have to remove the total gallbladder, but kidney stones it's like we can remove the only stones and leave the kidney like that as before. So what is kidney stone? We should know first how it comes, then only we can prevent it. So almost every patient kidney stones is always silent. So for to know how it comes, we should know first what is the function of kidney. Normally in our body there are two kidneys in the backside. So what does this kidney do? This kidney filters all our waste products from body and it comes out through urine. So during this filtration process, the kidney filters the blood and it produces like ions. So when these ions get more in amount, then this gets deposited inside the kidney as stones. So to give an example, suppose we add some salt in the water glass. So when we add salt, it dissolves. Then if we keep on adding the salt continuously, at one point of time, the solubility threshold will go increase. Then this salt gets deposited at the bottom of the glass. Like the same thing happens inside our kidney. So once this ions or solutes gets more in the blood amount, the kidney threshold for excretion increases. Then it gets deposited inside the kidney. That's how it forms. It's called as aggregation, enucleation, then silent. So first during this step, the kidney you will be totally silent. These all stone formation process will be silent. So normally like patients they come for other tests, then they get it detected. No, so when it grows like a very big size, then only patient gets pain, then it gets detected. So to know when this one thing is when these solutes grow in extra amount inside the body, it gets deposited inside the kidney. That is the number one reason. Second thing is when we take less water. So as I told, if we add more salts inside the water, this water needs to be more. If we are like less hydrated, then these solutes will get deposited. There won't be enough urine production inside the body. That will get deposited inside the kidney. So there are two basic principles for kidney stone formation. First thing is we should produce enough urine so that all these extra solutes will get excreted in the urine. Second thing is if possible we can avoid these extra salts intake. So next thing is how what are the foods we can take or like what to avoid. Normally patient comes, they ask us ki, sir, should I take beer? If I take beer I produce more urine. Should I take it? Then see, if you take beer, that it's like it will produce more urine, but we can't recommend you take beer. So what do you should do? Normally we should take more liquids. It's not like beer is also liquid, but if you take more liquids, the ideal urine output should be more than 2.5 liter. If our urine output is more than 2.5 liters, then only these solutes can get excreted and they won't get deposited inside the kidney. But I won't recommend that you take beer, but instead you can take more citrus juice and water, coconut water, barley water, like these fluids. Second thing, what we need to do extra things to prevent these solutes to more extra. Like there are body basically there are 5 types of kidney stones. Like most common is calcium oxalate stone, then uric acid stone, then phosphate stone or infection stone, then cystine stones. So most commonly what 90% of people they get is calcium oxalate stone. So in this stone there are two solutes, one is calcium and the second is oxalate. We can the first thing, as I told, we can do one thing, we can reduce calcium and oxalate ion intake or production inside the body. So what are the sources of calcium inside body? So they like calcium will normally we take milk, in that also calcium is there. Some patients they ask, sir, should I take stop taking milk if I get kidney stone? It's not recommended. So what is to be done? Suppose if you are taking outside source of calcium tablets without anything any bone, without any bone disorder, then that should be stopped. It's not recommended to stop taking milk totally, but instead we can do one thing, we can reduce our oxalate intake. So what are the foods rich in oxalate? Normally if we take more artificial drinks like artificial sweeteners, cola drinks, spinach, brinjal, and chocolates, nuts, then this should be reduced. In this, these are highly rich in oxalate, so we can reduce intake of these ions, and then ultimately this the stone formation will get down. Then next thing is uric acid. So next common kind of stone is uric acid. So inside body, if when we take animal food, animal proteins in high amount, like it's not necessarily red meat, if we take regularly meat and chicken and fish and egg, and if you are not properly drinking water, like you are dehydrated, then comes the problem. So we should reduce our intake of daily protein like red meat, chicken, fish. We can we can take it weekly, twice or thrice like that. But suppose some patient they come and ask, sir, I am habituated to taking meat regularly or alternate day, so I can stop taking it. Then it's recommended ki if you are like habituated, you can't stop it, you increase your fluid intake, you take more citrus fruits. Now coming to citrus fruits, what happens in citrus fruits? Normally, as I told, these solutes get deposited inside kidney after getting supersaturation. So if we take citrate foods, there is an ion called citrate. These citrate ions, they bind with calcium. So there is no calcium available for binding to oxalate and less formation of calcium oxalate stone. So we need to take more alkalizing liquids like citrate, orange, lemon. Then more citrate will bind to calcium, and in that way we can prevent calcium oxalate stone formation. Then next common thing is very important is salt intake. Why the patient they come and ask, why we need to reduce our salt intake, sir? Anyway, stone is calcium oxalate, no, why we need to reduce sodium chloride? So when we take more salt in our diet, what happens ki more calcium gets excreted inside kidney. To retain the salt, sodium, more kidney excretes more of calcium in the urine. So there is more available calcium in the urine, which binds in turn again to the oxalate, these ions. Then again the stone gets formed more. So we need to reduce our salt intake less than recommended is less than 5 gram per day. So as a general practice, you can reduce your salt intake to less than half of your daily intake. In that way also we can prevent the stone. But to out of all these things, the most important thing is taking of fluid. We should make sure that the total fluid intake should be more than 3 to 4 liters per day. In that way, total urine production will be more than 2.5 liters. But there are two exceptions. This fluid is not intake of 3 to 4 liters is not recommended for all. Suppose some patient is having cardiac failure or renal failure, they should consult their doctor, and accordingly they should manage their fluid intake. But so to summarize these things, like what are the dietary factors, like we should take for 3 to 4 liters of water daily, and reduce our animal protein intake, and reduce our salt intake, taking more of citrus and citrus fruits, then we can prevent it. Suppose somebody got a stone, then what we can do? So they as I already told you, kidney stone formation is a silent process. So until it gets to a size like 5 mm or more than 5 mm, there won't be any symptoms. So once it gets more than 5 mm, and it has to pass through the kidney tube, ureter. The ureter is very small in size. So any stone more than 5 mm comes inside this tube, then you will get very severe pain. So what are the symptoms of kidney stone? We should know, then only you can come to us for treatment of kidney stone. So the symptoms will be any flank pain, severe flank pain in the body, backside pain, and blood you may get blood in urine also, vomiting, recurrent vomiting, and if it is like long term stone gets obstructed in the tube, you may get fever and blood in urine also. So to summarize, like the symptoms are kidneys, any flank pain, recurrent vomiting, nausea, and blood in urine. These are the danger signs. If you get these signs, then you have to go to a urologist and get it examined, do a basic ultrasound scan. In that ultrasound scan, we will be able to know whether there are stones or not. So where is the stone, whether it is inside the kidney or the tube or bladder. Then comes the treatment. So the treatment depends on the size of the stone and location of the stone. Suppose the, like inside the kidney small stones are there, which happens most of the time, 70%, then we leave the patient. It's just we need to modify our lifestyle, do daily some exercise, fluid intake, then these stones will pass ultimately. But if it grows more than 10 mm, then it is difficult. We have to go ahead with surgical treatment. So what are the treatment options? There are various treatment options, like nowadays we can get it treated with laser without cutting, without any cutting outside the body. We'll go through the urine rasta and remove the stones. Whenever the stone size is less than 20 mm, we can do this procedure. This is called as RIRS. But once it grows in size, then we have to go with mini PCM. There we will make a small hole inside in the flank region, then we will remove the stone. So there are like two outcomes of every stone formation inside the kidney. Either it will drop through the tube, ureter and bladder, and it will pass in urine, or it will continuously grow in size. So to prevent its recurrence and formation, we should be like careful and modify our diet. That's it.